Hello, my name is Keelan McLaverty. I'm a consultant obstetrician here at BHRUT. I'm going to be joined by one of our anaesthetists and one of our midwives, and we are going to talk to you today about what to expect when having an elective caesarean section. This is when your caesarean section is planned in advance.
Hi, my name is Sean Little. I am a midwife. The first thing we will discuss is preparation for the elective caesarean section. This will happen in a few weeks before your elective section date and will be arranged by your midwifery team. During this time, you will have routine observations done, blood tests taken to check you are not anemic and to confirm your blood group in case you need a blood transfusion during or after your operation. You will be given some tablets to reduce the acid in your stomach and prevent sickness. And you will be given information about when to stop eating and drinking in preparation for your caesarean section.
On the day of your caesarean, when you first arrive at the hospital, you will be taken to a side room on the labour ward or into our pre-operative area. You will see a midwife, an obstetrician and an anaesthetist to go through what to expect on that day. You will be given name bands and special stockings to reduce the risk of blood clot formation in your legs. We will perform routine observations and will check you have had your pre-medication tablets, and we'll check when you've last eaten or drunk anything. You and your birth partner will be given theatre clothes to change into. The obstetric team will come to see you and discuss the consent form for the caesarean and go over any questions about the operation you may have. They may also examine you at this time.
The anaesthetist will also come and see you to discuss the anaesthetic plan. This will include the type of anaesthetic you will have for the procedure. For an elective caesarean, most women prefer to be awake for the arrival of their baby, and this is considered the safest option. They will therefore have a spinal, epidural or combination of both. This is called a regional anaesthetic. Sometimes a patient is not suitable for these, in which case a general anaesthetic would be used where you would be sleeping. If you would like more detail about the different types of anaesthetic used, then please see the video entitled Anesthesia on the Labour Ward. After seeing the team, there may be a wait for some hours before you go to the theatre. On arrival into the theatre, you will meet the whole team looking after you. This will include the theatre team, the anaesthetist and the obstetricians. The anaesthetist will then place a cannula in your arm for fluids and other medication. You will have monitors attached to check your blood pressure, heart rate, oxygen. These can be placed away from your chest for skin to skin after birth. Once the monitoring and the drip is placed, the anaesthetic can begin. The regional anaesthetic, your anaesthetist will explain the exact position they would like you to sit or lie, but this is normally with your chin to your chest, relaxed shoulders and curving your back as demonstrated here. The nurse will help you with a pillow. The spinal or epidural will allow the anaesthetist to give strong painkillers, all of which are safe for you and the baby. They will surround the nerves that supply the sensation to the tummy, bottom and the legs, making these feel very numb. Cold cleaning solution will be sprayed onto your back, then a local anaesthetic injected to numb the area. After this, you will just feel pressure and pushing in your back. If you feel tingling, it is nothing to worry about, but please tell the anaesthetist. It may take several minutes for the spinal anaesthetic to be placed and be attempted on more than one place on your back. Once the spinal is in, you will feel your bottom, legs heavy and warm. The sensation in your tummy changes, and this will take around 5 to 10 minutes and sometimes longer. Whilst waiting for the spinal anaesthetic to take full effect, your midwife will ask your consent to insert a catheter into your bladder, which you will not feel, and you will Then receive an antibiotic prior to surgery to prevent wound infection. Your blood pressure may fall after the spinal and you can feel sick. This is easily treated by giving a medication into your arm to bring your blood pressure back up. This will take the sickness away. Your anesthetist will check they are happy with the block using a cold spray. Once they are happy, the surgery can begin. During the operation, you will feel pulling and pressure but should not feel any sharp pain. If you are uncomfortable, let the anesthetist know and they can give you more pain relief or in some instances a general anesthetic. Once the baby arrives, it may be possible for skin to skin if everything permits. Sometimes baby needs checks by the pediatric team or the midwife, and it is not always possible. After the baby is delivered, you will receive medicines to help the womb contract as well as pain through the drip.
After the operation, you will be moved to the recovery area and have routine monitoring for about 30 minutes. Here, you will be able to drink and maybe able to eat. The midwives will help you with feeding your baby, whether it will be the breast or the bottle. Once the nursing team are happy that your pain relief and general observations are within the normal range, they will transfer you to the postnatal ward. You should have sensation return to your legs within a few hours, and we encourage you to get out of bed as soon as you feel ready. Once the drip and catheter are removed and you are comfortable on your painkillers, you can start to plan to go home. This will normally be the day after you've had your cesarean section. The nursing staff and the medical team will arrange iron tablets, blood thinning medications if these are necessary for you to take home. Your stitches are self-dissolvable and they should dissolve within 14 days. In some instances, this may not happen and they may need to be removed by your midwife. With regard to your pain relief, please take it regularly so you can move around, as it is important to move around once you've had your cesarean section. It is a 6-week recovery period. Thank you. You have been watching the video on elective cesarean sections.